make us start. Thank you, Daniel. Thank you, Elizabeth. Excellent. Right, welcome back. I'm delighted to introduce Christine, our next speaker, who will talk to us about PAC and the work being done there. Christine, over to you. You're on mute.
All right, hopefully. Is that back on the screen that I was sharing? Yeah.
It is, yes.
Everyone
Thank
see the
you.
PowerPoint? Okay, perfect. Sorry, I had to go back into Teams to then be able to share, unmute myself. So, my name's Christine. Welcome everyone to the Physical Activity Clinical Champion training. This is an introduction to the PAC programme, which is available nationally. But before I start, if you just scan the QR code, and then it's just going to ask a few questions about kind of current knowledge and skills around physical activity, and then you'll have another one at the end. And Sajija's going to put that in the chat as well. But a little bit about me. So, as I said, my name's Christine. My background is I'm a clinical exercise physiologist. I worked for about 7 years in the OUH cardiac rehabilitation team, prescribing physical activity to patients following a cardiac event. Alongside my place-based PAC role, which I work for Active Oxfordshire which is an active partnership in Oxford. I also work as a health promotion practitioner specialist in the health improvement team at OUH. And I guess what will be nice is that a lot of people have talked about kind of the passion, wanting to support these deconditioned people that we might see, and the PAC programme can kind of help around the kind of skills and the knowledge. So hopefully will be a nice next step in today's agenda. And then a little bit about what I enjoy. I enjoy running. This is me at the end of Manchester Marathon at the final bit. Hopefully you can see how much I was pleased to get over that line. First and only marathon, but thoroughly enjoyed it. Okay, so what is PAC? So in 2014, the government launched this Everybody Active Everyday framework, and essentially it highlighted the critical role that healthcare professionals can play when it comes to empowering people to become more active. And this was the driving force behind the Moving Healthcare Professional Programme. So there was kind of an understanding that actually a lot of health professionals don't necessarily have physical activity as part of their training. And so the PAC programme is designed to give that peer-to-peer training around physical activity, the evidence base, the benefits, talking about risk, and then some practical skills on how to be able to have these conversations. It's now PAC is overseen by a consortium which is made up of the Faculty of Sports and Exercise Medicine UK, the Advanced Wellbeing Research Centre at Sheffield Hallam University, and Intelligent Health. And in my place-based role, I'm essentially kind of focusing on delivering the PAC training specifically to healthcare professionals working in Oxfordshire. So we kind of, people have already talked about physical activity already. We've looked at the guidelines, but I guess one thing to start on is just that if we can sometimes move away from using the word exercise and move to more to physical activity, this might mean and translate better to patients who maybe, you know, feel that actually doing exercise could seem like a bit much. So trying to kind of use this term physical activity. And we know that any activity is better than none and more is better still. And thinking about the people who are already deconditioned, this is what's really key. And what is it essentially? It's any bodily movement that expends energy. And as I've just said, it means different things to different people. So who we're talking about, a lot of people already, the speakers this morning have talked about this kind of patient-centred approach. So depending who we're talking about physical activity might differ in how we actually get that message across. So Utundi kind of went through the physical activity guidelines, and this is the guidelines that exist for adults and older adults. And a few people have mentioned this morning about the 150 minutes of moderate activity per week, or the 75 minutes of vigorous intensity activity. But I guess when we're thinking about this population of deconditioned, inactive people, it's maybe just thinking about some of the other bits on this infographic as well. So just minimising sedentary time alone could really improve somebody's risk of all-cause mortality, because we know that sitting is an independent risk factor for all-cause mortality. And Joe and I think Flick already said this already about kind of Geraldine getting people kind of out of the bed, sitting in a chair, for example, if they're in the hospital, and then things people can do around the home. So just getting up, mobilising a little bit more, even if that means using frames, etc. Strength and balance is key, and it's key for everyone across the lifespan, as Utundi already said. And it's idea is that we should be doing this 2 days a week, and it doesn't need to be going to the gym, it doesn't need to be lifting weights. It can be carrying shopping bags, it can be using tins of beans, it can be doing press ups against the wall, it can be standing out of a chair. And then when it comes to balance, again, to kind of prevent that deconditioning and risk of falls and fractures, doing balance even from an earlier in our lifespan would help to reduce that risk of muscle aging and osteoporosis and reduction in bone density. So yeah, those infographics are also available to print, so you could always put that up in your area. And then moving on to intensity. So this is kind of important if we're talking to people to think about how they feel when they're actually doing some physical activity. And the most probably one that's common that we use is the moderate one. And if you were trying to explain this to someone, it's where they can talk, but they wouldn't be able to sing. So they can say a few sentences. That would suggest they're working at a bit more of an increased level. And even if we shift people from being in that sedentary infographic zone into light, again, they're going to get a big benefit. And then even move people from light to moderate. So we don't need to be thinking about the higher intensities. And I'm not going to talk about METs today just because I don't have a lot of time. But essentially, it's just doing a little bit more than we're already doing would have an impact on our health. So in terms of England, how inactive are we? This is from 22 to 23 data from Active Life Survey, and it is self-reported. So the idea is that probably this is higher than it is. 1 in 4 people are doing less than 30 minutes of activity per week. So that means they're inactive, and probably the deconditioned population we're talking about today probably all fit within here. We also know that if someone has a long-term health condition, a disability, and as they get older, their activity levels drop as well. And I guess to highlight here is that actually, age, and I think Utundi said this already, is we should just be doing as much as what we were sort of at 75 that we'll be doing at 65, because that's really important to maintain our muscle mass. In terms of the Bob population, we are slightly better than England average, but that doesn't mean we should give up and we should stop. We're just under 1 in 5 people being inactive. And in our role as healthcare professionals, we can really support people to think about how they might be able to become more active just through having a simple conversation with people. So who has the most to gain? Hopefully, I've kind of already suggested this, but it's essentially people who are sedentary. So people who are doing less than 30 minutes a week by becoming more active would get the largest gain in health benefits. This is from the W Health organisation, physical activities guidelines, and essentially it is a dose response curve. So the more we do, the better, and this will peter out. But you can see the area of highest impact is just going from doing nothing to something. The UK Biobank there was some research that showed that a 10-minute moderate paced walk a day for 6 days of the week, so that's 60 minutes in a week, could add a year to your life. So we're not even talking about getting to 150 minutes for some people, and that's what's probably bearing in mind to think about, is if people are deconditioned. They might get put off if you start talking about 150 minutes, but actually what's their starting point and how can they get started and how could you support that? Lots of benefits of physical activity. And I think probably this is the reverse. I mean, Geraldine gave a really nice overview at the start in terms of what happens when we get deconditioned. And essentially, if we maintain good physical health and physical activity and strength and balance, then we can reduce, things like cardiovascular disease, diabetes, hip fractures. I think the evidence says that a third of people who have a hip fracture actually go home and live independently, whereas another third might go home and need care or have to go into a caring facility, and one third likely die after a hip fracture. So it just shows if we can maintain physical activity pre kind of getting to this stage, which we're going to look at next, has a real impact for improving our independence. Which brings me on to this interesting slide. So this is about successful aging. So the green line is where someone has maintained regular strength and balance activity throughout their lifespan. Whereas the blue line is what happens when we don't maintain regular strength and balance throughout the lifespan. So you can see even in early life, you start to see a change and a difference in those two levels. And the successful aging will always stay beyond the disability threshold. Now, there might be times in people's lives where they do dip down a little bit because they break a bone or, you go through menopause or you're pregnant and where activity levels might not be as great as what they once were. But actually, the evidence is that we should maintain activity throughout these things where possible. But you can see that if once someone's crossed into that disability threshold, they're going to need more support from the system in terms of kind of social support as well as caring duties, family and friends, and then are likely, as Geraldine already said, going to need to be readmitted to hospital or have longer stays. Whereas through strength, balance, training, that can really help to maintain our muscle strength, our bone health, which underpins our ability to keep ourselves standing up and looking after ourselves and reduce things like osteoporosis. So I think that's quite a good slide for what we're talking about today. And then some people might be thinking, okay, yes, lots of benefits for physical activity, but I'm still concerned. I know that someone raised earlier, maybe they weren't very sure what they should be suggesting. And that's fine, that might not have been in your training. And there's a consensus statement that was done by Reed et al. In 2022, which basically looked at the risks of physical activity for people living with long-term health conditions, and that QR code would take you to the actual study. But essentially, the top 5 things that came out of it is that benefits do outweigh the risks. The risk of adverse events is very low, but that's not how people feel. So that's where we can play a role as healthcare professionals and sort of reassuring people that moving their body would be a good thing for them to do. We know it's not as easy as telling people to move more, and I think everybody who spoke earlier kind of already said this. It's about being patient-centred, it's about working on the same level as them, partnership, co-creation, all that kind of thing. Acknowledging everyone has their own starting point, and so someone getting moving is going to look completely different to somebody in the next bed next to them. And then, yes, there will be times where you might need to stop and seek a medical review, or there are some conditions where, a medical screening might be needed prior to someone taking part in physical activity intervention. So, putting the evidence into practice. So, how can we actually have better conversations about physical activity? And I guess first thing probably is useful to look at is what are the barriers, and if you want, pop in the chat. I don't know if I'll be able to see it, but I'll try. What you find are some of the barriers when you're talking to people about physical activity. This data is from We Are Undefeatable, which essentially spoke to 2,000 people who are living with long-term health conditions to find out from them what are the top reasons as to why they might not participate in physical activity. And the main things that came out was things like pain, not feeling energetic enough, concerns about making their health conditions worse. And on the right-hand side of the screen, we've got capability, motivation, opportunity. And essentially what we know is that this forms part of the COM-B model. So somebody needs to feel capable, they need to have the opportunity, and they need to be motivated in order to actually make a behaviour change. So by having better conversations with people, finding out what they're already doing, what they feel comfortable with, what would they like to get out of, or why is it important to them to move their body more? What would that mean to them in terms of going home? You can start to kind of build that importance and readiness to change in their own mind. And only a couple of minutes left. I won't really be able to go through motivational interviewing. If you had the full pack session, it goes through this in a bit more detail. But it's that person-centered approach. It's about discovering and trying to evoke change talk, listening to their ideas, putting yourself in their shoes and understanding kind of their concerns, and then hopefully being able to work through and find a solution together. People might be aware of the stages of change. This model essentially it looks at where someone can go from not even thinking about becoming or doing a behaviour to all the way through to maintaining. And I just want to highlight contemplation in terms of where we might see people who have been thinking about becoming more active, but they're just undecided. And that might be because of fear about their condition or about falling or whatever that is. And one approach that you could use and take away is the ask, share, ask, where it's a way of information exchange and it's about being patient centered. So you might already ask them what they know. So, what do you know about some of the benefits of physical activity? Um, then once they've told you a few things, you would then share. Would it be okay to share with you what other people find helpful? And when we're sharing this information, it's about doing it in a neutral way. So saying things like, we know that people who are able to get out and sit in the chair or mobilise a little bit more in hospital tend to go home and live independently better than people who don't. You know, it can be things like that. And then asking what the person makes of what you've just said. And that way you can sort of introduce a conversation in quite a nice way to get people thinking about activity and how it might be useful for them. So just a summary, there's another QR code which Jill put in the chat, and you just have to say that you've had the mini slide set from today. This will then essentially give you access to the slides that you've seen. But essentially we've just hopefully looked at how every move counts and that more is better, and we've had a little look about you know, the safety that physical activity can be for everyone, and a very brief introduction to behaviour change. Just to go on from this a little bit more, in terms of anybody who works in Oxfordshire, this is some information about supports. We have a fantastic programme called Move Together, which essentially a healthcare professional can refer in or somebody can self-refer. And there is lots of activities. The things that's probably most relevant to this group is there are things like strength and balance, seated activity, even home-based activity support where a personal trainer can go into someone's home and do some physical activity with them. Essentially, someone comes into the programme, they'll get signposted into the relevant type of programme that's suitable for them. So maybe Stay Strong and Steady, for example, is a good example of this. And people really get a lot out of it. I don't, because of time, I can't let you read all the quotes, but you'll get the slides afterwards anyway. And then if you work in Berkshire, then it's Get Berkshire Active, and this would be the website to have a look at in terms of finding out what support's available for the people that you see. And if you work in Buckinghamshire, then it's Leap, and they have just launched or are about to launch a similar Move Together programme. And again, there's lots of resources there available. So just finally, if you would like to actually have a full pack training session for your team or for some colleagues, then do get in touch. I'm happy to do that, be a bit more interactive than what we've been able to do today. And then another really great resource is the Moving Medicine website. If people haven't seen it before, a lot of information about prescribing movement and how to have conversations. And then We Are Undefeatable, I just want to draw people's attention to, is designed for people with long-term health conditions and very simple activities they can do. And that's it. And just thank you to the consortium for kind of putting these slides and everything together. I can answer any questions in the chat. Sorry, I think I've gone slightly over time because I didn't get my mic working straight away. But I will stop sharing, Sujija, so you can get the next presentation up.
Thank you so much, Christine. I'll let Geraldine do the setting up in the background, but that was absolutely brilliant. Amazing slides, which, as you've said, we'll share with everybody afterwards, and some amazing resources there. In terms of, please do get in touch with Christine. Motivational interviewing principles. Our previous Bob personalized team did a lot of training around this, and you may have already did the training, but what they have done is they've created some resources which is on the SharePoint, so please do reach out if you would like to tap into those resources as well. And just so that we can stick to time, if you've got any questions for Christine, please do place them in the chat, and Christine will very kindly have a look at that for us. Thank you so much, Christine. Right, so next we have a joint presentation from the Occupational Therapy and Physiotherapy team, so Flick and Nicole at BHT. They'll be walking us through a real case study showing how deconditioning impacts practice and recovery. So we have a video to watch first. So Geraldine is doing her magic at the moment.
Fingers crossed, yep. Technical challenge number 2. Okay, if you just, I can't really see anybody, so if you just let me know if the sound is all okay.
So, John,
the sound is working, thank you.
About your experience of going into hospital, having been a very fit and well and active gentleman prior.
Well, I'll start from the beginning. It actually happened. What happened was I was putting washing away upstairs in the bedroom, and I was bent down to put some trousers down. I then fell on I slipped down onto the floor.